coming together for a cause without hidden agenda, just helping everyone else. Myself and Chris are probably one of the least people affected by this actual lockdown. You know, but we're here fighting for freedoms. We're here to voice the concerns of people. We're here representing everyone who's afraid to speak up, who's afraid to hold the backlash that we're all facing. You know, we're strong enough to hold on for that. Some would, sometimes we take some too. We're all humans, right?
Yeah.
So today I want to discuss a few things. One would be the long-term care homes. If you really think about it, it took an army, literally our armed forces, to come into our long-term care homes. First of all, to help our failed government to even look after our people, and more than anything, to finally expose the decades of degradation of long-term care homes. What they showed to us was nothing new. I personally looked over the report from Auditor from 2009. So over 10 years ago, there was a report already showing all these disastrous situations with people are forced to leave it. But I want you to read some of the summary of the report. I had a friend of mine doing this, so you guys can see exactly what's going on. So this is from Crystal Nastasia. She's from Vancouver. We have a team of people working. Again, if you want to participate, we have private chats, people coming together, spending their own time, helping the cause, doing research, creating articles. We definitely need all the volunteers to support us because we're just here to help Ontario, to help Canada.
All of us matter, guys. All of us matter. All of us can make a difference.
Canadian citizens in long-term care homes facilities in Ontario were neglected, abused, and deprived during COVID. But this is not only a recent problem. A recent report by Canadian Armed Forces found the following: significant fecal contamination in patient rooms. Patients forced to sleep on beds with no sheets causing skin wounds. Starving patients, missing meals, not time food service for hungry patients. COVID-positive patients left to wander, infecting healthy individuals. Inadequate staffing and lack of reporting. Wrong medication administered. Hydromorphone, a strong pain medication, being skipped, causing patients to be in extreme pain. Dirty facilities not being disinfected, infected with insect and cockroaches. Confusions of do not resuscitate orders. Inadequate supplies with limited access. No bathing patients for weeks at a time. No evidence of patients being moved out of bed for wheelchair daily. Some patients bedbound for several weeks. Lying to families about health status of patients. Reusing of catheters. Aggressive handling of patients. No patient's dignity and inappropriate comment directed at residents. Putting patients on mattresses on the floor so they could not get up and roam around the facility.
Vlad is talking about the abuses in long-term care facilities that were discovered in BC in this
Hours
case.
passing before wellness checks. Staff members avoiding shrouding postpartum care or diseased patients. You can read the report from Canadian Armed Forces below. Be reminded that our elderly and most vulnerable Canadians were not isolated and protected when we had previous information about the need to protect them from COVID. The current living standards are nothing I would wish on my worst enemy. If our government can dump $850 million to World Health Organization for vaccine, they can certainly do something better for our parents and grandparents.
Woo! We definitely deserve something better.
So Doug Ford, like, I have goosebumps reading this. Like it's I personally, on my live streams over a month ago, I called this for what it's for. It's a genocide of our elderly population.
Unfortunately,
It's
very
a strong
sad.
statement, but it's a necessary statement to really think about.
They want to get
It
rid of
took
people
place
that
in
are on the
long-term care
government
homes in
purse.
Ontario and across Canada, but Ontario and Quebec being the hotspots, so to speak. It's genocide of our elderly population.
If you
And
have
all your
a
resources, and
family
Doug Ford
member in long-term
admitted
care
at
and
the
you can
briefing
take them out,
that all
you're
the
better off doing
resources
that.
were put in the hospitals to create capacity for the surge that they were expecting from this virus. He admitted in a briefing over a month ago that he followed a wrong advice from his so-called experts to create over 10,000 hospital beds for the surge capacity. And that's why he did not have enough resources to put them into places that actually needed the most, the long-term care homes. He admitted it. over a month ago. So please, Doug Ford, why do you still listen to the same experts that you admitted gave you the wrong advice to begin with?
Ooh. Yeah.
I said this before and I'll say it again. At Toronto level, Dr. Davila has to be fired immediately and held responsible.
Ooh.
Dr. Williams in Ontario has to be fired and held responsible. At the federal level, Dr. Tam has to be fired and held responsible.
Yeah.
For thousands and thousands Canadians dying because of the measures that they imposed on the whole country.
Because
and
of
the misery that's been created because of those measures.
delayed medical
and the deaths are going to be
procedures.
coming in days to come and months to come. Nobody's talking about the collateral deaths. So let us be the ones talking about the people that are not being talked at all. They've been discredited. All lives matter.
Yeah.
Long-term care homes lives matter.
Yeah.
People with cancer surgeries lives matter.
Yeah.
Heart disease lives matter.
Yeah.
People committing suicides because of their depression,
Isolation,
because
depression.
of the economic collapse of their social life. People not able to socialize with each other. All those things
Horrible.
are responsible for causing misery and ultimately death of people on a daily basis.
Yeah.
I said this again. I really would love Dr. Davila in Toronto and Dr. Williams in Ontario actually give me the statistics for suicide in the last 3 months.
Wow.
Out of California, they actually announced it, that in 4 weeks, I believe, they had more deaths from suicide than the previous year combined. They talked about it openly.
Oh my God. Oh my God.
Like, this is why we have people going on a hunger strike, because of the mental health issues that people are suffering. We have Matthew over here, if you don't know Matthew over there with Kelly. He's fighting for mental health for our city, for our province. It's emotional, for sure.
Thank you.
I feel his pain.
People with mental health issues are particularly vulnerable during this
The
time,
money
guys.
keeps going to
Social
the
isolation,
companies, to the UN,
criminal.
to World Health Organization. Why? Why he's giving the money to develop a vaccine for the virus
That nobody wants.
that's less than futile than the flu? Again, the real data now shows more people die from regular flu than from COVID. It's the truth.
Yep.
Especially once you actually look into wrong label deaths. We know World Health Organization created the guidelines that people should be labeled on a certificate death dying from COVID, even just having the actual virus inside, but not being the cause of death. And they actually instructed the countries around the world not to do autopsies.
They're diagnosing
Why
based
do you
on
do autopsy on
symptoms.
someone? To actually
Ridiculous.
see what's the actual cause of death. But the countries around the world were instructed by World Health Organization do not do that procedure because they were afraid that, of course,
There's a lot of
the doctors
information
actually
on
will
this
see
out there,
that
guys.
This is not what we've been told from the beginning.
Check out Del
And
Big
finally
Tree's
now in
YouTube
Germany,
channel.
in Italy, guess what? We're doing autopsies on people.
Oh, thank
And they're actually
goodness.
finding out that
Italy
this
is
is definitely
breaking
not
free.
what we've been told from the beginning. And that's why I've been so outspoken for the last 3 months about World Health Organization being as corrupt as they come.
Oh.
Tedros, the director of the World Health Organization, if you don't know, is the first non-physician of the World Health Organization. So when someone tells you you're not a doctor to give your opinion on Facebook about what's going on, please tell them. The director of World Health Organization is not a doctor.
Yeah. And in fact, he's
So
a
if
known
he can give his
criminal
opinion,
who has
I
covered
certainly will do so as
cholera
well.
outbreaks in his home country.
And guess what? When he was a health minister of Ethiopia,
There you go.
he actually covered 3 outbreaks of cholera. Do you think we can even fathom to take someone's opinion like that, let alone trust blindly the instructions coming from such a person? And once you really understand all the money being funded to World Health Organization by Bill Gates and Gavi, and guess what's happening now with our liberal government? And it doesn't really matter the parties. Again, this is not a political
Disgusting.
issue.
Yeah.
I said this before. This is not a political issue. This is a life issue.
Yeah.
All lives at stake. Doesn't
Yeah.
matter your religion. Doesn't
Yeah.
matter your ethnicity. Doesn't matter your backgrounds. It's all lives matter.
Yeah. Thank you, Vlad.
Enough is enough.
Enough is enough. Enough is enough.
Guess what now we know in the news that yesterday several media sources actually showed to us that now we have 37 million syringes bought out by federal government.
Oh my God.
And Dr. Tam said, just to make sure we have enough for everyone who wants to get it done.
Yeah, really.
But I mean, it's a coincidence, it's the exact population of our country. Like, really?
Funny, not funny, guys. This is not acceptable what they have planned for us. It's very
The other thing I'm
sobering.
gonna say,
We must stand up in larger and larger
going
groups
back
and
to the
oppose
long-term
this
care
evil
home
agenda. We have to take a stand for ourselves, for our
because we're here
loved
in
ones,
Ontario, right?
for the Canadian people, for the whole of humanity, guys. We have to take a
So here in
stand.
Ontario, this is from a different person. I think today will be definitely a good point to discuss long-term homes. So our government in Ontario removed thousands of elderly from hospitals' beds to free up room, even after the infections peaked in hospitals and were not overwhelmed. To long-term care homes, elderly residents with underlying conditions. So basically, they took people out of hospitals and actually put them into long-term care homes to actually continue spreading the virus. It makes no sense.
Well, if you're gonna believe in the whole virus narrative to begin with,
This is the timeline. Actually, this is what I wanted to
I
read.
consider it very
So
suspect.
February 23rd,
but
2020,
hey.
the deaths worldwide from COVID-19 surpassed 2,400. Ontario Chief Medical Officer Dr. Williams, and that's the person I've been talking from the beginning, I want to assure the public that the risks of Ontario remains low. March 8th, Canada's first death from COVID-19 is reported in long-term care homes. March 11th, pandemic called by World Health Organization. March 12th, Italy has 1,600 deaths. Ford urges families to travel and enjoy themselves as schools close for March break. March 14th, Italy has 1,266 deaths, majority elderly patients with underlying diseases. Ontario has 79 positive cases. Dr. Williams strongly recommended that long-term care homes cease non-essential visits, but doesn't make it in order. March 17th, Doug Ford declares the state of emergency. March 18th, outbreak declared at Pinecrest Nursing Home in Bobcaygeon, Ontario. Within 3 weeks, 28 of the home's 64 residents will die. March 19th, a woman in 90s in long-term care home shows 6 COVID-19 symptoms. Public health unit receives her test results 4 days later, the day she dies. Canada has 36 deaths. Italy 7,500 deaths. March break ends near. Dr. Williams recommends 14 days of isolation for healthcare workers who have traveled internationally, but does not make it mandatory. The federal government waits until March 25th before ordering a quarantine. March 22nd, Dr. Williams asks long-term care homes to limit number of locations employees work at wherever possible to reduce the risk of staff carrying the virus from home to home. Canada has 20 deaths. This does not become a mandatory policy until much later, April 22nd, when Canada has 1,974 deaths.
It's debatable, in my opinion, whether
April 22nd is when
measure
only in
is
Ontario
even
they
necessary,
made it
guys.
mandatory to make sure that they limit the transmissions between long-term
This
care.
isolation of the
How's that even
elderly
make sense?
is not
And
a good
months
idea, in
before
my
they
opinion.
knew about the virus, they knew that the risk population is our elderly people, specifically in long-term care homes. Those are the isolated people already. They're not even leaving the premises. But we, all healthy people, supposed to be staying at home
That's a good
and
point.
not actually working on creating the herd immunity, which will prevent the spread to begin with.
That's right.
Ridiculous.
Ridiculous.
March 26, province continues to recommend against testing everyone in long-term care homes that sees outbreak. Canada has 39 deaths, Italy has 80 to 100. March 27, Associate Chief Medical Officer of Health, Dr. Barbara Yaffe, on why province isn't ordering testing on all long-term home residents where outbreaks are declared. This is what she said. We don't want to use up the limited lab resources to test everybody when we already know that the cause of outbreak is. Remember, Ontario did not use 500 private testing labs and refuses the Ontario Medical Association offer of family physicians no longer seeing patients to open COVID-19 assessment centers for long-term care homes. Isn't this specifically
Interesting.
premeditated actions of our government to not actually do something about long-term care homes?
Right. They wanted the situation to get bad enough
This is why I say
to
the genocide
justify
of our elderly population.
all the ridiculous measures they've
The
since
facts are there.
imposed on
This
all
is
of
not
us.
made up. This is actual information, easily accessible by anyone willing to take a look. March 28th, outbreak in Bob Cajun long-term care homes is raging. About 50% of staff sick with COVID-19.
Guys,
March
we are
30th,
once
9 deaths in
again
Bob Cajun long-term care homes.
at Queen's Park.
This is what Ford said.
Vlad is
We are
talking.
putting an iron ring on protection around our seniors. We must do everything we can to prevent further spread in these homes. Canada has 89 deaths, Italy has 11,591 deaths. Elderly hospital patients are still being transferred into long-term care homes, and staff are working free but still infectious in between homes. Again, I repeat, at the end of March, we still have elderly hospital patients being put into long-term care homes. Why? The hospitals are empty. Leave people where they are so they can actually get proper hospital care and not infect other people. It makes no sense.
That's right.
What does Dr. Williams thinks about this specific thing right here that I just said?
Hospitals are empty, guys.
Williams, David Williams.
A doctor has
Ontario.
Rebel News interviewed the doctor
March 31st,
who
reported
said that in a
challenges Ford.
14-hour
We've
shift
known
he
for
saw
some time that this
no
is a vulnerable
no
population.
patients.
Why did the province
Ontario
not act
doctor,
sooner
Rebel
to
News,
stop
check
the
it out.
virus from spreading into long-term care homes? This is what Ford replies. I just wish we had a crystal ball. I'm sorry, like I thought you
No
had
words.
experts around you. I thought this is who you're relying on fully to guide the policies, guiding 15 million people in this province alone, and be an example for the whole
I
country.
really
by the way.
appreciate all the
Because this
research
is what
that
they do in other
Vlad has been
provinces,
doing,
where they have barely any cases at all.
and
They
the
use
fact
in
that he's
provinces
speaking
like
out.
Quebec and Ontario to scare people in those provinces, telling them we don't want to be like Ontario, we don't want to be like Quebec. That's why we still need to extend the emergency orders. That's why everyone
Ridiculous.
still have to keep the distance and all that nonsense stuff. Where again, they actually tested. The PubMed has a clinical study done with over 400 people where the transmission from asymptomatic, I call it healthy people, please.
Yes,
You really need to
yes,
change the vocabulary. and the
yes,
wording.
yes,
So the
yes.
transmission between healthy people, non-existent. And yesterday I saw another statistics from China where they tested over 7,500 people and only one transmission was documented. I repeat, over 7,500 people transmission within healthy population, only one got documented. Like, how is that even possible to justify still having everything closed outside?
Boo! Boo!
Let me finish this and I'm just gonna make a couple more points and I'll bring Kelly here. So I just wish I had a crystal ball, right? So can we maybe create a new experts panel for Doug Ford, since he only wishes to have crystal ball to ruining the lives of 50 million people in Ontario? Like, this is what he
Boo!
said. Like,
Disgusting.
how can someone like that
He
lead-
has lost the confidence
lead
of
this
the
province?
people severely, and
For sure. So at the end of March,
you know what?
oh yeah, this is the statistic that I mentioned before. Please remember, guys, when you're talking to other people and you tell them the death rate from flu is worse than COVID, and they ask you how is that possible, this is the statistic that I've been bringing to people. So remember, for us, it's all about putting a seed of doubt for someone. We're not going to be able to convince them completely, but at least if we
Well,
can make
especially
them
the ones that
pause
have been
and
super
think,
indoctrinated by the
this
mainstream
is really
media.
what we have to take as a mission for us, the main group of people that already got this, to spread the message and grow our movement. We really just have to create a seed of doubt for somebody just to even pause and think, because they've been brainwashed, bombarded by the media and the government.
And I
don't
think
want
more and more people are
to
waking up and
This
thinking
is
for
the statistic.
themselves.
In Canada,
I have faith
there
in
were
people.
8,511 deaths in 2018 to 2019 from influenza and pneumonia, with about 3,500 Canadians dying each year from influenza, which can lead to complications like pneumonia. This is the statistic, just remember. 8,500 deaths, over 8,500 deaths previous season from flu and pneumonia. And we did not do any of these measures for that. You know why? Because there is a simple ratio, cost to benefit ratio.
Right.
And,
right.
and as a harsh it might sound,
So now you
this is how the
understand.
policies are created on social economical level.
What
It's
we're
a
dealing
cost
with-
to benefit ratio.
what we're
So
dealing
if
with
we
is an
implement,
agenda.
Specific measures and policies to save specific risk group. However, it will cause deaths in all the other groups. You don't follow those policies because this is how you outweigh. You cannot have both. You cannot save people because locking everybody else, because then again we discussed people committing suicides,
Yeah.
the surgeries have been cancelled, so people died from cancer and heart disease. All those
So sad.
has to be considered, and that's how the policies are created. However, they completely discredited and discarded all those important issues. Let me wrap this up. I can send this, guys. I'll post it on my Facebook. You can see it. At the end of the point, this is what I want to make, and then 2 points. One is we need to have independent investigation and query into long-term care homes, and Doc Ford doesn't want to have that.
Yeah. Oh.
He does not want to have independent investigation to long-term care
We
homes.
need that. Yeah.
It took military to come in and to shed the light, because those people actually have a chain of command that they're not supposed to break, but they broke because they just couldn't withstand. The military man could not stand in the places where I read all those things were happening. No one could. Doesn't matter how hard of a person you think you are, and strong and capable. Like, this needs to be known by everyone. So the last 2 points that I want to make is unfortunate that our government at all the levels, and as much as I love animals, I also love kids. But think about this.
Of course.
We have dog parks open.
Jeez. Wow.
Yeah, off-leash parks are open. Everybody knows that or no? Yeah. Yeah. The dog parks are open. However, the playgrounds are still closed. How does that make
Boo.
sense? The
Boo.
golf courses are open, but the playgrounds are still closed.
Unbelievable.
The summer camps are closed, right? Now, the other thing, the grooming places for animals are open. However, for people, no.
Wow.
So where's the priority for the government?
Oh my
Again, as much as I
God.
love
Wow.
animals, I
Wow.
also love people.
Wow.
What's up with the double standard?
Wow.
But this is the double standard that this government been doing from the very beginning, where they imposing the
It's
policies
an
on the
agenda
regular
of
population,
oppression,
and
guys.
they acting completely
We
different.
cannot
Again,
stand for
let me
that.
remind you, Tory was hugging nurses in front of that hospital a month ago.
Yep.
He was at the Trinity
Photo
Valley
ops.
Parks last week,
Yep.
hanging out with people. So he's okay to do that, but we're not supposed to do this, right?
Unacceptable.
Doug Ford traveling to his
Unacceptable.
cottage, doing whatever he wants. This is the double standards that we need to understand. This is why we say it's a pandemic. Not because the virus is not real. Some people are actually dying from this virus, most of them because of other conditions or whatnot. But we say this because they use this virus to install the agenda and push specific agenda on people, right? This is why we call it a pandemic. Not because people are not dying from the virus, but because it's been used at a broader form to create what we have now. A population that's as miserable as it has been in the history of a long time, and they're using this as the worst enemy that we ever faced, as I said yesterday, Tori called that. So all those things must end now.
Yes.
We'll probably talk a little bit later, but I think I talked enough for now. Let me bring Kelly, and thank you so much. Stay healthy. Love you all.
Woo!